right, hello everyone, and thank you so much for joining us. This is Georgie Carter from PROPEL Health. I'm delighted to welcome you to today's webinar entitled Building Pathways for Health Policies in Malawi. We have a great session for you today, and we'll begin with just a couple of announcements. This session is being recorded, and we will post the recording to the PROPEL Health YouTube page. Now, we'd love to hear from you, and we welcome your questions, and so please submit them via the Q&A feature on the top right side of the meeting, and our moderator will read them aloud when we pause for questions. Now, this webinar is being conducted in English, and the slides are displayed in English, but if you would wish to view the slides in another language, you may select Translate Slides at the bottom of your screen and select your language of choice. Finally, we ask that if you are not speaking, please mute yourself to keep the line nice and quiet while others are talking. That concludes our announcements, and I'll now turn it over to my colleague, Dr. Sunita Sharma, Project Director for PROPEL Health. Sunita?
Thank you, Georgie. I want to start with thanking USAID for the opportunity to work on PROPEL Health project. And we just completed 1 year, so I would like to provide a brief overview of the project. So as you know, the project PROPEL Health focuses on achieving health outcomes, essential services, family planning, reproductive health, HIV, TB, malaria. We are doing a lot of work on primary health care. And in this, we focus our attention on policies, financing, governance, and advocacy. So we do a lot of work from policy to action. We also financing in terms of sufficient, predictable, and sustainable health financing, governance, enhance stewardship, transparency, accountability, and advocacy at all different levels, global, national, and subnational levels, how we can incorporate best practices in policies, plans, and strategy. So our focus is on integration and advancing government priorities and actually implementing initiatives, USAID initiatives of primary health care, global health security, workforce rationalization, and sustained epidemic control. Next, please. So at this time, if we look at PROPEL Health, we are doing a lot of work on implementation. So we work at all different levels of legal regulatory reforms. We're looking at policies, strategies, action plans, but also a lot of focus on how we can align all these policies and strategies. Most of the countries are moving to one plan, one budget. So we are looking at how we can align policies, strategies for different disease programs to one health sector strategic plan. We are also looking at how we can make policies much more inclusive, the development and implementation of policies. In that case, how we can use digital tools for the policies so that we can have feedback mechanisms at the community level, as well as top-down approach for policies. And we do a lot of work in terms of looking at how it can be much more resilient. So our policies, as you know, and there are a lot of changes, climate change, we are talking about political situations, we are also pandemic. So when all these changes are happening, how our policies stay relevant, they are effective, and they can be adapted for these contexts. So this is after pandemic, we know that everybody is realizing health is so important. So health in all policies and how we can really elevate our essential services, family planning, reproductive health, HIV, maternal child health in policy, fiscal, and governance space. In financing, we are looking at sustainable, predictable financing. Our major focus is on efficiency, as we really looking at strengthening public financial management systems, aligning planning and budgeting cycles, also looking at or improving budget execution. We are helping countries with financing reforms, decentralization reforms, in that really looking at how we can maximize overall resources for primary healthcare, how we can really help countries with resource pooling and purchasing, also cultivating enabling environments to catalyze private investments in health. So we are promoting use of financial information in decision making, and all these efforts like really thinking about sustainability, looking at putting in place mechanisms, systems, institutionalizing those, and strengthening capacity so that things can continue in the long run. We are also looking at public primary healthcare financing within that context, insurance systems, and other ways we look at for financial protection as well as access to quality services. For governance, this time governance is broader than health sector for Propel Health. So we are doing a lot of work on strengthening stewardship capacity, supporting accountability and transparency throughout the policy ecosystem. We are boosting decentralization, also very involved in management reforms, because for primary healthcare, it's really important for us to look at all levels of management strengthening. And as I mentioned, advocacy is part like integrated in everything we do at the global, regional, national, subnational levels. And we are participating in global dialogue discussion to understand some of what are some of the best practices. But at the same time, we are looking at engagement of our country staff, local expertise to really inform dialogue discussion at the global level. Next. So as I mentioned, we have completed 1 year. We are working in 17 countries. We have 10 mission buy-ins, and localization is really, we have a very comprehensive approach. 25% of funding goes to local organizations. We have already achieved 93 results, which are policy, financing, governance, advocacy results. So it is quite impressive. This is really great job done by our country teams and working in country leadership and advancing country priorities. Next. So we have an excellent consortium. As you all know, Avenir Health, RTI and PRB, we have been working with them long time. They bring a lot of expertise. We work well together, as well as we have 2 new partners. So we have AERC, they're based in Kenya, that's Economic Policy Group, and they have network of 22 universities and 13 think tanks. They work directly with ministries of finance, which is really a great addition for sustainable, predictable financing, as well as Samasha, a lot of expertise in governance. We have several project partners with niche expertise, AHB for private sector, Ariadne Labs, primary healthcare, Athena economics, so multi-sectoral participation, Busara behavioral economics, O'Neill Institute, their legal regulatory reforms, open development to facilitate G2G partnerships, and UCSF for integration. So I will not take much time now. I'm so pleased to introduce, actually, Kenya is one example I wanted to talk about. So we, in Kenya, for example, we are working on costing and data analytics for new social health insurance scheme. We are supporting to design, implementation, and monitoring the primary healthcare strategy. We are strengthening capacity for evidence generation for domestic resource mobilization efficiency. We are working with county level leaders to help with the budget formulation and execution. We are leveraging existing data systems for evidence generation and use, and we are piloting decentralized drug distribution model for antiviral drug refills for community pharmacies, and strengthening governance, stewardship, and leadership for national programs. It has been great experience working with our AOR, Veena Menon, and we highly appreciative of missions for buying into Propel Health. So now I'm very pleased to introduce our country director from Malawi, SANDRA MAPEMBA. SANDRA.
Thank you very much, Sunita, and welcome everyone to the PROPEL Health Malawi Pathways to Policy, and for joining us to kind of share and hear on all the achievements that we have done in such a short time, between 6 to 8 months. Our work is mainly aligned to supporting achievements towards Malawi's development goals, and mainly through what we call Malawi Vision 2063. But within this, we are also aligned to the USAID Malawi Country Development Cooperation Strategy objectives. And in the past 6 to 8 months, we've achieved quite an amazing set of results in through working with government. The results have put us onto a good footing for year 2. So, for example, in 6 to 8 months, we've managed to actually develop 5 policies from start to finish and launched. And alongside that, we have 26 tools, guidelines that kind of relate to the implementation of the policy. And we do have some other policy documents that are drafted and just awaiting approval. As part of localization, we've been able to disperse about $100,000 to several CSOs to advance work on safeguarding access to information on SRH for people with disabilities. So the development of Braille materials that we'll be distributing this year. We've been looking to evoke facility and community accountability and working with regulatory bodies to kind of enforce civic participation and issues of quality of care. And further to that, we've also been able to sub-grant to religious leaders or religious umbrella bodies to advance issues on finding boys to men, to bringing them to HIV testing, care, treatment, but also starting the conversation around gender-based violence and looking at transformative ways in which we can basically combat those, and have had quite a lot of success in bringing people to care. And finally, we've also been looking at capacity strengthening, and through district level or the decentralized level, we've really been trying to build the capacity in terms of data literacy, in terms of data quality assessments, in terms of increasing access to services. In terms of use of data. And so if you look at one of the trainings that we actually did working with the decentralized level, mixing these with service providers and looking at the central level, we were able to actually incorporate HPV testing within the cervical cancer piece in such a short period of time. And just based on the skill set and the conversation, or the cross conversation in terms of district level, facility level, and service provider and national level, we've managed to do the registers and get the M&E tools going. And this has expanded HPV testing from 11 sites to 21 sites. So we've also then looked generally at policy target groups and looked at how we build various capacity in that. And so we've worked with young people, we've worked with communities, we've worked with a lot of target groups in such a short space of time. But basically, I think what is impressive is in the 6 months, we have managed to kind of complete most of these tools. So I think the next slide kind of highlights the tools that we have actually, or the policies we've actually developed, but particularly on the health financing, where Malawi has changed the way its approach to how it's actually offering health services and looking at a one plan, one budget, one M&E, and PROPEL Health has really worked with the ministries to come up with an operational plan, a resource mobilization plan, a budget, a budgeting tool, and amongst others. And I think we've really managed to advance this agenda where now the Ministry of Health is rolling out this one plan, one budget, and one focus for HIV. So I think our approach really to the results that we're seeing here can mainly be achieved by the linkage that we have to government and how government kind of takes the leadership role in terms of setting the agenda, the tone, and then coming to the project for tools such as evidence generation. So looking at, they come to us looking at how do we kind of make sure people understand the issues, what kind of data can we generate? So how do we come up with fact sheets? What models can we run? And so we come up with bulletins, we've run the rapid, recently we've run through Avenir Health, the FP never former current model, which kind of informs us where we should be going in terms of investments for family planning in Malawi. And then we look at digitalization, where government is looking at how do we kind of have the interoperability of systems, but also kind of how does the end user use it? So it's not just for facilities, but they're looking more towards how do communities use it. And the approach there has really been about accessibility, looking at functionality and looking at access and doing the analysis before kind of coming up with these digitalized tools. And so we've had the youth management information tool that we're using. We're looking at probably in this year a self-care app. And so kind of taking those issues into consideration. And finally, I think really strengthening coordination, collaboration and government structures through capacity strengthening, which has also been a mainstay in terms of how we approach policy. And so through all these co-creative processes and joint planning and documentation and provision of technical support to government, today, we really want to highlight through our partners, the government here and one of our youth champions, through two specific areas. So the first one is really about the launch of two key policies, the population policy and the family planning policy this year, and then also one on capacity development of an impressive group of youth leaders whose utilization of advocacy and leadership skills clearly show that investments in policy areas strengthens youth participation, enables contribution to governance, and generally impacts their life today and for a longer time to come. So we'll start with the family planning policy. So on June 1st, 2023, Malawi's Ministry of Health launched their 2030 country commitments. The commitments, co-created by health and non-health actors, focus on a range of areas, including fertility, reproductive health, gender, and education. By providing a multifaceted and inclusive framework for achieving the country's national family planning goals, Malawi's FP 2030 commitments and their launch guarantee the government commitments to improving Malawians' living standards and the quality of life. The commitment by the US government, continued support during the event, will greatly assist Malawi in its family planning efforts as we strive for efficiency, equity, especially for unmarried and young people, and consistency in commodity security. This support is critical for Malawi to reposition family planning as a crucial component in achieving the long-term visions for the country. Ahead of the launch, PROPEL Health provided support to the Ministry of Health, Reproductive Health Directorate, and coordinating partners, line ministries, to finalize the commitments, mobilize additional resources, and jointly plan for the implementation of the launch. Following that, in July, Malawi launched its national population policy. And again, PROPEL Health worked alongside the Ministry of Health, the Ministry of Finance and Economic Affairs, and other partners to develop the policy, usher it through adoption, and officially launch it. The policy represents an important milestone to Malawi and its progress in meeting the national development goals is fully dependent on the implementation. If fully implemented, the national population policy will result in Malawians having greater access to adequate, high-quality social services and economic opportunities. So with us today is Ms. Mary Mulonga-Piri from the Reproductive Health Directorate of the Ministry of Health, who has been at the core of this partnership for the two policy documents mentioned. Mary, maybe in your own words, maybe you can describe the distinctness of PROPEL Health's role in finalization, in launch and forward-looking of the post-policy launches.
Thank you, Sandra. Good morning, good afternoon. Actually, first of all, I will outline the overall government priority, which is to transform Malawi into an inclusive, wealth and safe, resilient nation by the year 2063, much as we also have the sustainable development goals and other commitments. So to achieve this, sectoral policies on population and sexual and reproductive health and rights, and also the voluntary family planning in particular, are focused on improving the quality of the population and making, or even ensuring, high quality sexual and reproductive health and other social services available and accessible to everyone, and also improve social economic status for all. Indeed, PROPEL Health has done a lot and has greatly assisted the government and also myself as the focal person. The support from PROPEL Health aligns well with the vision of the government of Malawi, as well as the regional and the global commitments. The project builds on the success registered during the Health Policy Plus project. And there are some of these achievements as already updated is the revision of the sexual and reproductive health and rights strategy that will be implemented from the year 2023 to the year 2027. We also have the revised 2021 Family Planning Reference Manual. We also had an addendum to the CIP. So it's the CIP addendum that has been actually extruded from the year 2019 to 2022. And also the population policy, the 2023 population policy. Some of the key strategic approaches employed and that have actually greatly assisted PROPEL Health to support the government effectively, including convening policymakers, civil society, faith-based organization, the young people, and other stakeholders through roundtable meetings. Through the roundtable meetings, with the support from government, the project assisted to provide expertise to adapt and tailor-make solutions are being made suitable for local needs of the audiences. The major assistance that I particularly got from I got as the national coordinator for both family planning and the population policy revision was the use of experience for decision making. I've been in the family planning program since 2009, and I had to take the challenge of the national population policy. Actually, health policy, the HP and PROPEL, the health policy and PROPEL health projects have helped myself and the government to develop and implement many of the strategic government documents by synthesizing and packaging evidence and tailor-made messages so that non-technical people are able to understand data and prioritize policy issues in line with the government revision, and if even assisting me as the program lead. The project has supported the government to develop data-related products. We now do have the youth family planning and youth-friendly bulletins, the costed implementation plan dashboards, and also the AGY fact sheets, and also the FP 2020 review reports, much as we submitting in the FP 2030 reports. These are some of the area highlighted by SANDRA. One of the other areas that I learned through the technical support from the project was on partner coordination and collaboration, being the lead for family planning and also the revision of the national population policy. From this support, I have learned to use mapping tools, budgets, and documentation for the multi-sectoral engagement, and also partner buy-in, leveraging skills, resources, and also equipment, and gathering the inter-ministerial leadership, what we can even call the political leadership, because we have actually been also working with our parliamentarians. The project has supported me with the partnerships and actually a financial brokering between government and electorates, like when we were developing the national population policy, which is a multi-sectoral policy, CSOs and other stakeholders. Recently, the government supported the program and also government to mobilize over $64,000, which was used to conduct the FP review meeting. After we launched the commitments, our next step was actually to do a review meeting where we actually develop the 2030 work plans, currently in the draft form, and we are planning to actually clean so that it's a finalized document. And also strategies for the second costed implementation have been framed, and we are in the process of actually completing the process. Further, the coordination support from PROPEL Health helped also to mobilize over $40,000, and we do mobilize from all the stakeholders that are actually supporting government in the execution of family planning activities in Malawi, which we used actually to launch the family planning 2030 commitments. We had a very colorful event. A lot of resources for the NPP, the revision of the national population policy. These were actually being mobilized from the relevant stakeholders, including the process of us to ensure that we have a revised national family planning reference manual. The expertise from all this has helped my ability to provide oversight and the family for the family planning program at national and district and across the sectors. And I've even managed to gain confidence from the various stakeholders and trust. So this has made us easy when we know we present the budgets, they are able to fund us because they are rest assured that we have the capability through the support from PROPEL Health. Also, this led to the successful advancement of the national population policy. As already said, the Ministry of Health was given this mandate. Most of us are on health, we are nurses, midwives, but at an advanced level, so we know how actually to, with the support that we have, to actually develop and also lead the process of developing policies. And even in the formulation of the FP 2030 commitments, we also were supported and we provided oversight and leadership during the development of the ICPD at 25 commitments and the other strategic commitments. You might wonder to say what's the uniqueness of PROPEL Health that has supported in Malawi and the family planning program and myself as a coordinator in particular. So actually key to it, the PROPEL Health is the flexibility to the project to be able to adapt to government policies, even listen. Maybe I've taken the guidance from the focal person myself, and the availability of the specialized technical support to government through the two projects, and also PROPEL Health in particular was designated a technical officer, technical support, and we have always worked together, planning together, reviewing documents together. They have been helpful in helping with the IT services and also data needs. So they have been able also to actually maybe partake the guidance that we do provide as a Ministry of Health. We also have managed, they have assisted us to, they have the capability to assist us to integrate local solutions into their activities. We are able to actually guide them, and they would actually adhere to, and also to document and share results in existing forums such as the technical working groups, the meetings for others to learn and also possibly implicate not just the Ministry of Health, but the other line ministries. In conclusion, having business continuity with PROPEL Health as the Ministry of Health, it is actually being advocated for, as is allowing the Ministry of Health and other ministries to continue developing and implementing contextualized policies that align to the sectoral and overall national vision. And we actually are looking forward to actually working together with the PROPEL Health through the support from USAID. Thank you.
Thank you, Mary, for kind of highlighting some of the softer skills that we also bring to the table through technical support and helping with coordination and collaboration. And one of the core areas that PROPEL Health works in is youth. As we know, youth is at the core of many development agendas. And for us at PROPEL Health, our youth work really stems from the national and sectorial policy statements, such as promoting youth participation, increasing socioeconomic development for opportunities for youth, access to youth-friendly health services, safeguarding and inclusiveness, which are clearly outlined in documents such as Malawi Vision 2063, the HSSP3, the youth policy, the SRH policy, and other related strategy documents. And so for PROPEL Health, we assimilate youth activities within the larger policy development and implementation activities. So, for example, recently 30 youth leaders representing a variety of youth-led organizations from across Malawi graduated from a week-long, intense, highly participatory policy communication workshop. The workshop is about building young people's agency to identify policy issues and ably make a case for change. As such, participants then learn skills to effectively analyze data and present evidence-based policy-related issues that influence policy decisions. This space also provides an opportunity for youth leaders to actually test out what they've learned by interacting with government decision makers and the media experts to build relations and exchange tips on how to effectively engage with these groups around sexual reproductive health and rights, HIV, climate change, early childhood development, water, sanitation, and hygiene. Similarly, the Gender Action Learning Systems, commonly known as GALS training, which also targeted 30 youth leaders to recognize their assets, build agency in enterprise thinking, and promote participation of women and girls in socioeconomic activities using simple tools for low literacy audiences. This methodology has proven to be so effective that 11 of those already trained just last month have already cascaded the training, reaching 467 other young people and 100 community members. These two trainings were originally successfully offered under HP+. And within PROPEL Health, we are maintaining the methodologies, but incorporating youth members drawn from the HP Plus cohort to co-create and facilitate sessions of these workshops, and then mentor the new graduates starting from the workshop and providing the support in the real world. With us today is one of these mentors, Adora Mayer. Adora, maybe you can share your experience on the two trainings and how this has kind of led you on the pathways you are now.
Thank you very much. Good morning and good afternoon. My name is Adora Maile, and I am indeed one of the youth that have benefited from trainings that have been held by HP Plus and PROPEL Health. Of course, my first training with Healthy Policy Plus was in 2019 Youth Champion Workshop, where we were given skills like advocacy, resource mobilization, facilitation, proposal writing, among others. And at this time, I was still in college, and I had just joined the youth which meant that I didn't have a lot of capacity and knowledge as well as skills to go about whatever it was that I was doing. So the training really opened up a lot of doors for me. To begin with, the workshop. In the workshop, I started networking with my fellow youths, and coincidentally, we met the vice president, which was in the lobby. So we invited him in the meeting where we were able to interact with him on issues affecting young people. And he gave us some of the answers that we needed to hear. So my journey in development spaces started from that. And in 2020, I also attended the Enterprise Thinking Gender Action Learning System, in short, we call it GALS. This training was offered by HP Plus, and it was one of the trainings that honestly put me on the map. And I have used the knowledge and experience to apply for various opportunities, including Co-Africa Fellowship. The technical support offered beyond what I could manage helped me to succeed with some of these opportunities. For example, I remember asking Desio to review my Co-Africa application because I knew that he understood better these things. And he gave me a way forward to go about it. And I ended up being enrolled in the Co-Africa program. And I used the same GAUS methodology to mobilize communities and co-create action plans that were funded by Co-Africa itself and successfully implemented those projects. I also managed to apply just recently a call of application for a conference in the UK to showcase a creative tool and methodology that were successfully applied in Africa. So I cited GAUS methodology, and my application has been accepted, and I'm going to the UK on the 17th of November this year. So I was also certified by the trainers that were facilitating GAUS, the Meramo Consulting, and I was offered an internship where I have supported different projects within the country. I have been providing guidance on tools development, facilitation of sessions, and report writing. I still offer this support up to date, and HP Plus has exposed me to different opportunities directly and indirectly. And I have really achieved a lot of milestones, I can say. So one of these is the establishment of a consultancy that I have done with my fellow youth champions. And more recently, we have gotten a contract with Tinveta to conduct GAUS training in various districts around Malawi. So I understand where I'm coming from and where I am today because of how the journey has been, because I've been identified also as a mentor to other young people who graduated from the GAUS training that was conducted in August. And during the training, I co-facilitated the sessions, I supervised the participants, and I offered general support around their business ideas. And not only did I stop there, but I also attended the policy communication training in September to boost my skill sets. So these trainings have given me skills on how to present issues to decision makers rather than complaints. And I believe that I will continue growing because the capacity building from both projects have built my CV and expanded my networks. And I know it will only get better from here. So all these things are happening because HP Plus did not just train me in one thing and dropped me, but it has been with me throughout the whole process. Yeah, thank you very much.
So thanks, Adora, for sharing how your journey has evolved over time and how those skill sets are now being applied to help fellow young people under the PROPEL Health project, and also kind of how you're contributing towards policy development. And maybe we'll come back to that a little later. So I think at this point, the ability for young people to thrive in such a short period of time is really about the simplicity in which I think PROPEL Health offers its trainings to young people, and then beyond that kind of continues its support to these young people to kind of thrive. But since we've been talking a lot about our own approaches, maybe it's time I could invite Kimberly Call from the Malawi mission, who's been our AOR for the whole of year one and is still supporting us, to maybe share some of her reflections and discuss USA priorities and government. Over to you, Kim.
Thanks so much, Sandra. Yes, I'll clarify. Vina's the AOR. Here at Country Level, I'm the activity manager until just a few weeks ago now. My colleague Felix is. So it's such a wonderful team to work with. I wish I had a planet Earth background behind me. And we've had some internet connection problems at the office today, so I hope I stay connected. I know I only have about 3 minutes, so I want to emphasize a few things. That the thing that we believe is working so well for PROPEL here in Malawi is that it is very localized. Localization is critical to implementation, monitoring, and evaluation, because policies without these three things, especially implementation, do not do anything. They don't advance our CDCS, nor do they advance Malawi's Vision 2063, excuse me. And using localized approaches, PROPEL was instrumental in helping us advance the population policy. The population policy recognizes that in order to advance population growth, all sectors must be involved in things like job creation, keeping girls in school, contraception, everything. So since the population policy is housed in the Ministry of Finance rather than Health, it sends a powerful message. The population is not just a challenge that should be addressed via the health sector, but across all sectors. I'm delighted that this webinar included a focus on youth and that we got to hear from Adora. Congratulations, Adora, on your many achievements. It was really a pleasure to hear about all of them. Enjoy the conference. Best wishes in everything that you're doing going forward. PROPEL has done an excellent job of advancing the agency's positive youth development framework. It looks at youth programming holistically to improve youth's agency and assets, increase their contributions in their own development and their community's development, strengthens the enabling environment. That's what PROPEL's doing so well, so that, let's see, so that youth are supported, prepared, protected, and engaged. And in some cases, they lead the activities, the development activities that are aimed at them. And speaking of localization, USAID Malawi has been implementing 2 government-to-government activities for the past 3 years. We plan to expand into more districts going forward, and PROPEL is helping us devolve some of these important policy interventions to the district level. We're excited about some work that PROPEL's doing on direct facility financing. Even though there are significant challenges to overcome, we're confident PROPEL can help us alongside the government of Malawi achieve success in this area, because direct facility financing gives more autonomy to facility leadership, so they have the resources to pivot and address specific challenges facing their patient populations without waiting for central level action. Let's see, PROPEL also advocates for smart, necessary reforms to the health system. I'm sure you heard that prior from our illustrative speakers. And because these reforms are difficult, it's so important to build trust. And Sandra and her team have built really wonderful trust with the government. And we see that as one of the most important inputs that PROPEL is doing. Finally, PROPEL is helping us advance the agency's primary impact initiative. The majority of our efforts in primary impact are focused at district level, District of Mangochi. And PROPEL is helping us take some of those interventions. I spoke about how PROPEL helps us bring top-down approaches to the district level, but through primary impact, PROPEL is helping us bring bottom-up, district up to central interventions for wider adoption through the governance process. So you can see that PROPEL's working in so many different areas. They are seen as one of our most critical partners, and we're very proud of what you've already achieved in this just 3 quarters of implementation, really. So back over to you, Sandra. Thanks so much.
Great, thanks, Kim, and thanks for those kind words. It's, as Kim knows, we've been hitting the ground running, but it's been very rewarding. And policy work, as we know, is not always easy. But I think with the right relationships, with the listening ear, with the flexibility, we seem to at least navigate the government and build that trust and kind of move forward together. So at this point, I think the 3 or 4 speakers, the 3 speakers have basically highlighted some of our approaches, and we want to give the audience a chance to also ask any questions they may have, if at all, and maybe Georgie will let us know if there are any hands up, since we can't really see from this end. Or...
Hi, Sandra, nothing
okay.
yet. I'll let you know.
Okay. So maybe while we're waiting, Mary, maybe you can kind of share with us why coordination and collaboration is such a critical skill for government at this particular point in time.
Thank you, Sandra. Actually, issues of coordinations are key in order to actually deliver or actually attain the desired outcomes or deliverables. So if when we talk about coordination, it's a significance. There is a lot of significance that can be added. One of them is issues to ensure that there is areas of leveraging. So like leveraging the resources to avoid overlaps, leveraging of expertise and also knowledge. You know, when you are working with the multi-sector, it is actually necessary, and through the support that I have attained, because I've been there since the implementation of the policy project, then the health policy plus project, and the HP project, HP plus project, and also now the PROPEL Health. So being at that leadership level, you need actually to ensure that you apply coordination well so that you are able to leverage the expertise, look into and see to say, if I'm to deliver, who else can actually support me to actually deliver well in the aspects which I'm not skillful, or maybe when I have the gaps, and even leveraging the resources as already outlined and was already reflected, and because if you have gaps, others will actually come in and actually support to avoid the overlaps. And also even gathering the political and the interministerial support. We have been working with the parliamentarians to advance some of the issues, like now we have a budget line. This all comes in because of issues of coordinating with the relevant CSOs that would actually support you to actually conduct or build your advocacy skills, and also the use of data during evidence. So there is a lot of significance when you are coordinating, not just with our stakeholders, even the beneficiaries, the young people, so that we achieve the desired results.
Great. And then maybe Adora, you talked a lot about the skills from the enterprise training and the policy training, kind of helping you on your pathway. How's this basically helped you in the policy arena when, say, for example, development of policies? How have the skill sets helped you, and how have you known that there's actually been an impact from what you've contributed?
Thank you so much. So for me, honestly, I understand that without a platform and without the right skills and knowledges, you can miss some of the opportunities that are there. So the policy class gave me those skills and exposed me to some of those knowledge that I needed. So going through the training of policy communication, advocacy, it made me understand how best I can advocate for the issues that are affecting my fellow youths. I understood that I don't have just complain all the time. You're not involving the youths, you're not doing this. There was nothing really that was happening with me complaining. So I needed to know the right channels. Who is to approach, who is involved, who is the person in charge, how do I present this without the emotions, how do I logically make my voice heard, and how do I also help out the rest of my youth. So learning about how to go about it helped me to also help the other my other fellow youth. And I am sure that if I didn't understand how it's done, I wouldn't have been heard, because it could have been just like any other noise. But I knew the strategies, I knew the channels to go in those areas, and I knew the meetings to be available and what to say when I'm there, so that they are taken as important issues, so that every other person who is not having these platforms their voices are carried by me, and I present those things. So the skills that I have learned from these trainings have helped me to address the right issues, and those issues have been adopted. For example, the policy, youth policy, they have adopted some of the issues that we raised, like prioritizing youths that are living with HIV and AIDS. Those are some of the things that they didn't include in the policies, but because we raised those issues, they have been now included. The other issue policy-wise was how the youths are always in the end receiving, they are always the receiving people. They are not involved in the processes, in the planning. So in that way, we are now telling people that, okay, so don't just give to the youth. Let the youth understand why they are being given. Let the youth work with you throughout the planning process, so that they understand better. They know how to go about it in the end. When they receive, they understand where it's coming from, how it's done, so that next time they do it when they are now in the decision-making platform. Yeah.
Great. So you bring a great piece of sustainability up, and then also looking at the time. And if there are no questions, I think let me, it's a good note to end on. And so I think I would really want to thank USAID for the support that they've given us throughout the implementation and the collaboration that we enjoy. And if anybody has any further, I think, wishes to collaborate, please reach out to Vina and Sunita, and I'm sure they will take up these conversations with you as they go along. Otherwise, I think thank you to the panel, thank you, Kimberly, and thank you everyone for joining today's session.
Thank you very much, Kimberly and Sandra, everyone. Thank you so much.
Thank you. Thank you.
Thank you.
Thanks. Goodbye.